Hello everyone, my name is Tom Nguyen. Today I would like to present to you my DNP project. The title of my project is Improvement of Outcomes in Blood Pressure Control. According to the National Center for Biotechnology Information, hypertension is highly prevalent in the elderly population in the United States. Hypertension is the number one factor that leads to cardiovascular mortality, stroke, and disability. According to Carey and Welton, the 2017 American College of Cardiology and the American Heart Association hypertension guideline classify normal blood pressure as less than 120 over 80 milli mercury and stage 2 hypertension as systolic pressure that is greater or equal 140 millimercury or diastolic pressure is greater and equal 90 millimercury. According to Flues-Kiger, Longstreet, Harrington, and Gerber, patients with stage 2 hypertension are at immediate risk for stroke per Framingham stroke risk factor. According to MISA, stroke ranks as the fourth leading cause of death in the United States, and hypertension is the number one modifiable risk factor to prevent a stroke. Therefore, it is important to promote interventions to reduce high blood pressure with the systolic pressure at 1 greater or equal 140 or diastolic pressure greater or equal 90 in the elderly patient with hypertension to the 2017 ACC and ASA guideline for normal blood pressure, which is less than 120 over 80, to lower the risk of stroke from the hypertension complication. So the the purpose of the project, since 2014, for the last 5 years, I have been working as a family nurse practitioner at an outpatient medical clinic in Arcadia, California. This clinic is operated by an internal medicine doctor, um, me, and a few other supporting medical staff. The adult patients of this clinic have many chronic medical problems like diabetes, hepatitis, thyroid disease, arthritis, osteoporosis, hypertension, and other medical problems. I noticed that many of the elderly patients come to the clinic monthly for checkups and review of the medication that they take for their multiple chronic medical problems. However, I also saw that many of these elderly patients did not understand how to take their medication properly. Over the last few years, I had few elderly patients be admitted to the emergency room for hypoglycemic or hypotension because of the patient misunderstanding of how to properly take their medications. After these observations, I think that the medical clinic should make some changes on their ability to give better care to the elderly patient. I believe that the outcome of the treatment of the elderly patient will be improved if they simply know how to self-manage their medical problem. Therefore, the purpose of my DMP project is to develop a new evidence-based practice protocol for the clinic to implement to improve outcome in blood pressure control of the adult patient with primary hypertension to reduce the incidence of stroke through increasing patient medication adherence and self-care. So the project goals and aim. Um, the project aim is to decrease the incidence of stroke in 50% of all primary hypertension patients that greater than 65 years of age with current high blood pressure, with the systolic blood pressure greater than or equal 140 or diastolic pressure that greater than or equal 90 at the clinic by reducing their blood pressure to the 2017 ACC and AHA guideline for normal blood pressure in 90 days. So the four objectives that support the project aim are: one, identifying at least 80% of the patient that greater than 65 years of age with high risk high risk for stroke. Two, classifying blood pressure for at least 80% of the patient greater than 65 years of age with high blood pressure, um, um, that have systolic pressure greater or equal to 140 or diastolic pressure greater or equal 90. Three, educating at least 80% of the patient greater than 65 years of age and all the healthcare provider in the clinic on the importance of maintaining a normal blood pressure to prevent stroke. And four, placing at least 80% of the patient who still have high blood pressure that greater than with the systolic pressure greater than 140 or diastolic blood pressure greater than 90 into a blood pressure monitor club in the clinic. So the method for my project, that is one, uh, using electronic health record, the ACC and ASA hypertension guideline, and the Framingham Stroke Risk Factor tool. I search for all adult patients greater than 65 years of age with primary hypertension in the clinic with the current high blood pressure, that is systolic pressure greater than or equal 140 or diastolic pressure that greater than or equal 90 and high risk of stroke. So then I asked the medical staff to call and make appointment for this patient to see me to follow up their high blood pressure. Next, on the first visit, I carefully explained to the patient the purpose and the step process of the DMB project. I also have the patient fill out the Morisky 8-item medication adherence questionnaire so that I can measure the patient medication adherence to antihypertension medication. Next, on a weekly basis, I'm using the telehealth method. Uh, in my case, I will use the phone. I call and remind patients to take their antihypertensive medication daily. And then on a monthly visit of the patient, I have this patient come back every month for the next 3 months. So on a monthly visit of the patient, I measure the patient blood pressure and compare with the previous high blood pressure that recording in the ESR progress note before the project. And lastly, on monthly visits of the patient, for the patient with blood pressure monitoring that is still not within the ACC C and ASA hypertension guideline for normal blood pressure. I placed them in the blood pressure monitor club in the clinic so that the medical doctor can adjust their antihypertensive medication and reminding them about the routine exercise and reducing salty food. So, so the results after 12 weeks periods of my DMB project. Uh, so so for the 12-week period of the DMP project, I saw a total of 47 adult patients that greater than 65 years old with primary hypertension who have systolic blood pressure that greater or equal 140 at the clinic. The blood pressure data was measured and recorded for 47 patients during a 12-week period. And then from the descriptive statistic, I I saw that both mean and median of the systolic blood pressure and diastolic blood pressure of these patients show a downward trend over time. I did a pair t-test. A pair t-test is is used to compare uh, the changes and the results of the pair t-test show that on an average, both systolic blood pressure and diastolic pressure was significantly lower after 1 month, all with the p-value less than 0.0001. And then the mean value of the systolic blood pressure keep decreasing after 2 months, and the systolic pressure of most of the 47 patients decreased after 3 months. Um, so 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 after analyze the data, I can see that although the goal, of reducing, my goal is to reducing 50% of the patient blood pressure to the ACC and ASA guideline for normal blood pressure. Although the goal of the DNB project was not achieved, but the intervention significantly so reduce the systolic blood pressure and the diastolic blood pressure after 1 month, and also so further improvement um, of the systolic blood pressure after 2nd month and 3rd month. So therefore, in my conclusion, I think that the data results of the projects show a great evidence of success in improving the outcome of the blood pressure control, increasing the patient medication adherence, and reducing the risk of stroke uh, for all these adult patients with primary hypertension, because they bring it down to um, to stage 1 and even elevated blood pressure, um, and some of them go into the normal range blood pressure. Um, so I think it's the goal is achieved, and therefore I can develop a new standard of care guideline for the clinic to improve patient outcome in the treatment of primary hypertension patient. Um, so, um, so this is the end of my presentation, and thank you very much.